Well, thanks very much, Jim, and congratulations to Ralph Nader for organizing this nice party. You know, I came to Washington, volunteered with Ralph Nader. My first day on the job, I sit around with Ralph and a few of his aides, and Ralph says, okay, what are we going to do with this guy? He's got a PhD from MIT. And is that a good enough imitation, Ralph? And so one of the people sitting there was Jim Turner, who just that week was publishing a book called Chemical Feast about the Food and Drug Administration and its various failures and inadequacies. So this guy and Ralph said, okay, Jacobson, why don't you write a book about food additives? So I just come out of grad school studying a virus. I knew nothing about writing books, no idea about even what a food additive was. And I said, well, okay, guys, I'd be glad to do it, but how do you write a book and what's a food additive? And so they said, just go and do it. And it seemed like everybody on his staff was writing a book that year. So I scurried to the library, looked up what a food additive was. I don't think there was a book on how do you write a book, but I put my nose to the grindstone and wrote that book, which was novel back then because there were other books on food additives, but they were of, I don't know, it's like they came out of the 1930s or something. The authors had to prove that every food additive was dangerous. And I mean, they clearly aren't. And so I wrote what I thought was an intellectually honest book. And my conclusion was that food additives, like the sodium nitrite and the artificial flavorings, weren't nearly as big a problem as the foods themselves. All the sugar and the fat and the salt, and as my grandmother, unlike Jim Hightower's grandmother would say, all the chazarai in the foods. So I wrote the book, Eater's Digest, and meanwhile, I had met two other scientists working with Ralph, Jim Sullivan and Al Fritsch, and you'll hear Al Fritsch talk this afternoon. And we decided to split off and start our own organization, the Center for Science in the Public Interest. We had no connections, no money, and somehow, though, it worked out. Al is a priest, so he had free rent from the church, and Jim and I lived in group houses, and we managed okay. And we gradually wrote books and articles and pamphlets, got little grants that kept us going. As the previous speaker, Karen, mentioned, the idea of using mass media, and the media were so different then from now. Phil Donahue, who might be on this program later in the week, was just an angel in inviting public interest people onto his show and letting them advertise their products, their memberships or newsletters. And we had posters back then on food additives and nutrition, and we'd be on a show and sell thousands and thousands of posters. And newspaper columnists would write articles saying, talking about the issue and then saying, get this pamphlet for $1.50 or whatever. And we'd sell thousands and thousands. Coleman McCarthy, another speaker in the series Breaking Through Power, wrote a column about one of the things we wrote, and we literally had mail sacks of orders for the publication sitting outside our front door. So we lived on that sort of a thing. Then we started Nutrition Action Health Letter as a giveaway little newsletter for nutritionists who were somewhat progressive. And then after a year, we decided we couldn't afford to give it away for free anymore, so we started charging and gradually built that up into a real powerhouse of a newsletter. It's the largest health largest circulation health newsletter in the country now, with about 700,000 subscribers. And that's been the basis of our existence. And we've been so fortunate because we are lousy grant getters, but we write a pretty good newsletter. And so subscribers and some of the subscribers donate extra money. That's been the backbone of our financial support. And it's been very satisfying to have it under our control rather than having to beg foundations all the time. But if any of you are here, we'd love to have your money also. So, and you get a free newsletter subscription if you donate. So now we have 700,000 subscribers and about income of about $15 million a year, much of which goes to the post office and the printer. But as I was thinking, you saw Ralph's slide of executive salaries. $15 million is what the president of Coca-Cola got last year. And that was after a 40% pay cut. He was making $25 million, but he's down to $15 million. And the president of Pepsi, Indra Nooyi, makes a cool $26 million. But getting back to the substance, one of my conclusions from the book was that, writing the book, was that nutrition is more important than the food additives, though they are significant and very interesting, and we've kept working on those ever since. Back then, the mantra of the nutrition establishment, the Department of Agriculture, the American Dietetic Association, the food industry, and others, was a very convenient, self-serving, all food is good food, just eat a variety of foods and you'll be okay. So when I began looking into this, and I really knew almost nothing about nutrition, I began looking into it, and that clearly wasn't the case. And there was a shift going on from some professors, the American Heart Association a little bit, recognizing that the saturated fat and cholesterol and salt and some other things in food were major causes of heart disease, stroke, high blood pressure, diabetes. And there was controversy, but the whole conversation was shifting, as it shifted in many other fields that you'll hear during the conference series, from deficiencies of micronutrients to excesses of certain nutrients in our food. And that's what we've been working on ever since, to try to improve the quality of the American diet. And partly by educating the public, which I think is essential, but more by focusing on the kind of garbage that companies were producing and that government was defending. And I remember one debate I had. We used to give out the Bon Vivant Vichyssoise Memorial Award, given to the biggest junk food producer of the year. And we'd give it out at the convention of the Institute of Food Technologists, who are the people that create all this junk. And so I'm outside the convention, being in the award was a beat-up old garbage can. So I had the garbage can. NPR is interviewing me, and I'm saying, all processed food is junk food, as only a very committed young man can say with such fervor. And so right after I'm doing the interview, somebody from General Foods rushes up to the NPR reporter and says, "It's not true, it's not true." And the reporter gives him the microphone and says, "Well, tell us about the foods, that good, healthy foods that General Foods is marketing." And he says, well, we're working on one right now. And I think made it very easy to win the debate. So a couple of years later, I had the idea that too much salt was harmful, because there's a lot of evidence, even back in the 1970s. So a young woman just started work for us, Bonnie Liebman, in 1977, and I said, "Bonnie, let's write a petition to the Food and Drug Administration about salt, and that the government should limit sodium levels in food, put warning notices on canisters of salt, and a couple of other things. And back then, salt, and now salt, is considered generally recognized as safe. Companies could use as much as they want. So Bonnie and I and Georgetown Law School wrote the petition, and we've been working on salt ever since. The government has done virtually nothing on salt. Researchers, though, have been busy discovering that if we could cut sodium from salt and other food additives by 50%, that could save as many as 100,000 lives a year and $20 billion or so every year in medical costs. You know, just an issue of enormous importance. And meanwhile, salt is generally recognized as safe. And it's one of those issues that everybody here, all Americans know that it's safe. You know, it's on our tables. We wouldn't have anything dangerous on our tables that wasn't safe. So we've been working at it. We petitioned the FDA in 1978. We sued the FDA in 1982 for not taking any action. We lost in 1983 and went on to other things like getting that nutrition facts label on foods. And then we thought maybe, well, sodium would be listed on the label, every food, maybe that would get companies to lower sodium levels, consumers to choose less. But in 2005, we discovered that people were consuming as much sodium in 2005 as they were in 1978 when we started this campaign. So we went back to court. The court said, you got to petition the FDA again, which we did in 2005, and waited for a response. Got the Institute of Medicine to do a study that said that the report said that the food industry said it would reduce sodium levels voluntarily. Government urged voluntary reduction since 1969, and for the past 40 years there was no progress whatsoever, and that the Food and Drug Administration should set formal limits. So that was 2011. The FDA immediately said, we're not going to set limits, basically because the food industry wouldn't let it, but it would set voluntary targets. So 2011, we've been waiting for these voluntary targets, so we finally sued the FDA again to respond to our petition. That was last October. And we expect a response in about 10 days, so keep your eye on that. And I think that the Food and Drug Administration will probably propose voluntary targets, not mandatory, and then we're going to go through some long phase. But it's the first time the FDA has taken any real action to lower sodium levels, and hopefully the food industry will go along with them. And that's typical. These big things, every food company uses salt. Every restaurant has salty foods. These issues take a long, long time. There's a tremendous industry resistance. One of the things that happened quickly in this scheme of things is trans fat. Back in 1990, there was almost no evidence that trans fat was harmful. And then careful research showed that it raised the bad cholesterol in food, lowered in our blood, and lowered the good cholesterol. And that was the first human study done by the Department of Agriculture. And trans fat comes from partially hydrogenated oil, which, like salt, has been considered generally recognized as safe. And that's been an interesting issue. It went on we petitioned FDA in 1994, went through the usual public meetings and hearings and debates, then lawsuits, and finally in 2006 the FDA required trans fat on labels, which spurred a lot of companies to remove it. And finally last year the FDA banned partially hydrogenated oil and trans fat with a deadline of 2018. But 90% of trans fat Thank you. 90% of trans fat is out of the food supply. More than 7 billion pounds of partially hydrogenated oil has been removed. And I think everybody from the food manufacturers, the seed developers, farmers, everybody deserves some credit for that enormous change in our food supply. And the next one is sugar. I should say trans fat was causing upwards of 50,000 deaths per year, premature deaths per year. None of those heart attacks had a label that said trans fat, which makes it very difficult to deal with, hard to get the victims to be spokespersons. Sugar is another biggie. Just soda pop is killing about 25,000 Americans each year. And it's something that the battle lines have been drawn. Soda consumption is down by 27% since 1998, when we first really started working on this. Enormous change. And Indra Nooyi, president of Pepsi, $25 million a year. Pepsi sales have declined by 50% since 1998. And I would pay her money, a lot of money, to drive sales down further. So we'll see what happens. But I see my time's running out. I just wanted to mention a couple of the challenges. We're not eating more fruits and vegetables, despite all the farmers markets and Michael Pollan's and propaganda. It's ridiculous. We need to develop effective campaigns to improve the consumption of fruits and vegetables, which are protective of health. And more broadly, this citizens movement in the food area needs to do what it's doing in many other areas: keep the pressure on industry. They will respond to public pressure, whether it's over the web, in newspapers, or with your shopping dollars at supermarkets. And I think they deserve applause from time to time for doing the right thing. And so that's kind of the challenge in all of these environmental health, workers' rights, and other issues. We've got to use diverse strategies, from creative publicity to lawsuits to legislation. The greatest strength of the citizens movement is facts and credibility, and then persistence. You got to keep at this basically forever, because the opponents are going to come back. You know, it's kind of like the ocean and building sandcastles. The ocean's going to continue trying to come back and remove what you've done. But it's very gratifying to work on public interest issues, because you can have an impact. You're really protecting the public. And not only is it gratifying to do that, but it's also a lot of fun. So thank you very much. I really appreciate it.